All right. All right. Welcome to this week's Team Kentucky Update. We are operating with a skeletal crew today because the severe weather that is out there right now is both real and dangerous. Snow has developed across much of Kentucky, and it is expected to be moderate to heavy this afternoon. The roads are already incredibly slick across most of the state. We are seeing ice, and we're seeing numerous accidents and/or people needing help. A winter weather advisory has been issued in portions of central Kentucky, north of the western Kentucky and Bluegrass Parkways, where 1 to 4 inches of snow can be expected. The highest amounts of snowfall, 4 to 8 inches, are expected to fall across south central and eastern Kentucky, roughly from Bowling Green northeastward to Richmond. A winter storm warning has been issued in those areas. As the snow ends, temperatures, which are already cold enough to cause ice, are going to plummet into the single digits by Friday morning. And temperatures throughout the day on Friday will likely remain in the upper teens to perhaps as high as the lower 20s in some spot. We are urging Kentuckians to please not travel if you don't have to today. So if you are not an essential worker, please don't travel. If you are an essential worker and you have to travel, because some of the jobs simply cannot stop. We're getting vaccines out to the rest of the world, for instance, through UPS. Please drive slowly. Travel on multiple roads throughout Kentucky could be hazardous, especially during the evening commute. So if you are at work today, you are not doing an essential function where you have to be in that office or in that facility, we would urge you to get home sooner rather than later. Our Kentucky Transportation Cabinet began planning and preparing for snow and ice back in the summer, and most of our highway districts have been pre-treating roadways this week, taking advantage of the dry weather before this storm. But keep in mind, even treated roads can become quickly covered if there is enough snowfall, and visibility quickly becomes limited as well. Safety is priority number one. We want all of you out there to be safe. We haven't gotten through this much of a pandemic, of ice storms, of snowstorms, and of tornadoes to lose people today on the roads. So please be careful. We need the cooperation of the public. So here are 4 things the Transportation Cabinet is asking people to do. Number 1, limit travel to what's necessary when snow and ice are on the roads. Number 2, give snowplows plenty of room on the road. Number 3, make sure your vehicle is winter ready. We strongly recommend keeping an emergency kit in your vehicle. And this is the 4th ask that came from transportation. Mask up to slow the spread of COVID. Transportation cannot afford to have plow drivers in quarantine. They need to be available for duty. As we'll talk about where we're going in the current COVID surge, it can impact everything. It can very quickly impact public safety. So remember, when you make that decision to wear a mask in public when indoors, you are protecting the people that you need at different times to protect you. So due to inclement weather today, I closed all state office buildings as of noon. That was 30 minutes ago. Executive branch agencies will continue to provide services to the citizens of the Commonwealth, and the following staffing work requirements apply. All telecommuting employees shall continue to work based on their regularly scheduled hours. Essential employees designated for mandatory operations will continue to work. Essential employees include, but are not limited to, employees who work in 24-hour facilities like parks, hospitals, prisons, or residential facilities, law enforcement and emergency management personnel, and highway and road crews. Non-essential employees who are scheduled to work in an executive branch state office building who are able to are going to be working remotely, and they shall continue to work on their regular hours. If they cannot perform their duties remotely, they shall not report to work, and there's a process that occurs there. We ask state employees who have questions, contact your agency's management or human resources office. All right, this is just the latest round of severe weather. The last round occurred on New Year's Day. That's when we had to declare a state of emergency. So on Monday, I joined Mayor Wendell Lynch and Emergency Management Director Randy Graham to survey damage in Christian County, which was hit by an F2 tornado. The National Weather Service has confirmed 9 tornadoes affecting 10 counties with wind speeds ranging from 80 to 115 miles an hour. We also had extensive flash flooding in Greene, Barron, Taylor, Adair, Owsley, Breathitt, and Casey counties. High water blocked parts or all of multiple roads in Floyd, Knott, and Pike counties. We also had mudslides across the Commonwealth. Damage assessments are ongoing, but let me just say from Hopkinsville, it is an absolute miracle that not only no lives were lost, but there were no injuries. So very blessed, both that people were prepared, generally knew it was coming, but also a miracle given a couple of the stories of people who were out almost right next to the tornado and thankfully are still with us. So from the concern on the weather to the significant concern for the COVID Omicron surge. We are continuing to experience a surge in COVID-19 due to this variant. Omicron is now the predominant variant in Kentucky and across the country. And I just received today's numbers, 9,836 new cases. That is a new record after yesterday's new record and the day before's new record here in Kentucky. Positivity rate now at 23.67%. Nearly 1 in 4 people being tested are coming up positive. So this week we will surpass last week's numbers for most cases in any week during the pandemic. Hospital admissions are also increasing, and they're starting to increase rapidly. Although we're hopeful we will not see a similar increase in ICU admissions and patients needing a ventilator, there are still people getting very sick, and the trend does not look positive in either of those areas. So let's just quickly look at the line graphs for hospitalization first. Let's go to this one, James. He's doing 2 jobs today. As you can see, hospitalizations going up. There is real cause for concern that hospitals can and maybe will be overrun again. We are looking at plans on how to augment them, and we'll certainly want to lean on both nursing programs and, if necessary, the National Guard once again coming to our aid. But folks, you can help us. You can help us by getting vaccinated and getting your booster, which makes it very unlikely you'll end up in the hospital, and in wearing a mask when it's appropriate. If you don't help us in those ways, and if you're part of this significant increase in hospitalizations, that person that's hurt today in the car accident due to weather might not have a bed or the level of attention that they need. All of our actions have repercussions. We are all responsible for one another. We are our brother and our sister's keeper, and right now we can do the things that protect our own health, that keep us out of the hospital and ensure that there is a bed for a person who needs it. By doing the right things and by wearing a mask indoors, especially in large gatherings, you can also protect the nurses and the doctors that help people in these hospitals. You can protect the snowplow drivers that are out there trying to make sure you're safe. You can protect police and firefighters that are needed in times of crisis. So we need your help. While not increasing as quickly, and remember, it trails hospitalizations, ICU, if we could bring that up, also trending upward. And then finally, ventilators. Again, it's not a direct clean line, but we do see more Kentuckians on a ventilator right now than certainly before the holidays. I mentioned before, whether it's Delta or Omicron, getting vaccinated and getting your booster protects you from significant or serious illness, but also death. Let's look at age and vaccination status of COVID-19 deaths from July 2021. That's really about the time when everybody could be fully vaccinated, to January 5th. I want you to look at this. Statistically, if you are under 50 years old and you get vaccinated, you don't die. You don't die from COVID. But if you're under 50 years old and you are unvaccinated, look at that. It's about 450 unvaccinated individuals under 50 dead from COVID in Kentucky, right? And 15 vaccinated individuals. And then you look at 60 to 69. If you are vaccinated, you are so much better protected against this very deadly virus. And then if you're older, you are still so much better off. And as we look at the age distribution of COVID deaths, and this is really, when we look at the pie chart, the one on March 2020 to May of 2021 is really the first strain through Alpha. It's pre-Delta. It's also pre-vaccinations. And what it shows us is vaccinations have significantly reduced death of individuals, especially over 70, going from 3/4 to just under half. But look at what's happened with people ages 50 to 69, almost double, 24% to 40% of overall deaths. And then this ought to wake people up. 10% of all deaths since we got Delta and Omicron have been between people's ages 30 to 49. Every day, our list has people in these age groups. That's my age group, and now a lot younger as well, that are passing away and making up, for people this age, what is a huge portion of the overall deaths. Almost entirely, if we go back to the last chart, at 10% of overall deaths, 30 to 49. Look at that. Almost entirely unvaccinated individuals. Dr. Stack said it to us the other day, that if you are in that age group, really under 60, and you are vaccinated, if you get it, you might get a little sick, but most likely, statistically, you're going to be okay. If you are unvaccinated, that is not the case. Okay, a couple of updates on boosters. First, let me put up the first one, James. Yes, the CDC has now endorsed boosters for children 12 years and older. This is a big deal given waning immunity. I have a son who is 12. He is going to be qualified for a booster. I love that kid and his sister more than life itself. He will be getting his booster. It is safe. It will protect him. It'll protect us. It'll protect his grandparents. It'll protect the people that are around him and his friends. And I know he's ready for it. The other booster update is people who have received 2 shots of Pfizer can now receive their booster shot 5 months after their second shot instead of 6 months. So the time period for Moderna and J&J hasn't changed, but if you got Pfizer for your first and second shot, you can now get your booster 5 months after. And let me tell you, if you've gotten Pfizer, you gotten 2 shots, you need that booster. Absolutely go get the booster. If you've got Moderna that's been 6 months, go get your booster. I know I have. On some unfortunate news, based on wastewater testing, we now have some significant outbreaks in our state prisons across Kentucky. In Eastern Kentucky Correctional Complex, Kentucky Correctional Institution for Women, Rotorua Correctional Complex, Lee Adjustment Center, and right now that's our main list. It appears that we have significant COVID outbreak. Each of the facilities have more than 200 pending PCR test results. But at this point, 2 of our prisons, Eastern Kentucky Correctional Complex and the Kentucky Correctional Institution of Women, are moving into a lockdown. No visitation is going to be allowed in the next, and we hope it's a couple days, but at least until we get a firm grasp on the outbreak. So it's going to be no visitation, including virtual, because we can't move people right now. No movement within the institution because we got to figure out who is positive before they move into other areas where other people could be infected. And no new inmates will be coming into those facilities, and then they'll be separating them by test results. This is a significant situation, and it's exacerbated by high staff vacancy rates and a lot of staff testing positive. For example, at the Kentucky Correctional Institution for Women, we have a 67% vacancy rate for correctional officers. My budget is going to do what we hope is a lot to help address this, but low pay, not paying our state workers enough, creates unsafe situations like this. We do have in those facilities good vaccination rates overall for both our prisoners, and it looks like, this is the first time I've gotten this number, our staff, but Omicron is a tougher adversary in terms of spread, and we'll need to be checking on what's the boosting status in those institutions. All right. Speaking of boosters and vaccines, between yesterday and today, 2,777 Kentuckians got their first shot of hope. We like that number to be a little bit higher, but still, every day, it's steady. We have new people getting it. And 6,141 Kentuckians getting their booster. Fayette County has now become the first county where over 75% of all residents, eligible or not, have had at least one shot. So 75% of every man, woman, and child that lives in Fayette County has gotten a vaccine. Woodford County, next closest, at 73%. A couple of changes on our demographics. Always good when we see that. First, overall, 2,792,116 Kentuckians have gotten at least one shot. That's 62% of every man, woman, and child that lives in Kentucky. But now of the eligibility, we're up over 2/3. You want to double click it? There you go. We've gone from 66 to 67%. Again, in just over a year. This is the fastest mass vaccination in human history, and certainly in Kentucky's history. It's just not enough for what we're facing. And our capacity, if we have the willingness, is even greater to the extent where we could vaccinate almost everyone else if they chose very, very quickly. Total 18 and older, still sitting at 74%. You can go ahead and show all the others. The ones that changed, 25 to 39-year-olds, up a point to 61%. 12 to 15-year-olds, up a point to 46%. We have got to do better on this last one, especially 5 to 11-year-olds, just 17%. Some other good news. Today, I'm proud to report that the state's unemployment rates fell in all 120 counties between November of 2020 and November of 2021. According to the Center for Statistics, which is an agency of the Kentucky Education and Workforce Development Cabinet, the unadjusted unemployment rate for our state was just 3% in November of 2021. In comparison, the nation, almost a point higher, 3.9%. State seasonally adjusted rate of 4.1% was also below the national average last month. The county that recorded the lowest unemployment rate is Woodford County at 2%. You can learn more at kystats.ky.gov. Finally, last night, I was humbled to deliver my State of the Commonwealth address before the General Assembly. It was my third address as governor, and in many ways, it was both the toughest and the most exciting. It was the toughest because we've been through a lot. Pandemic, it's killed more than 12,000 people, people that we know and people that we love. Deadly tornadoes that just took 77 lives, including a child only 6 days old. Ice storms today, snowstorms. It has not been easy. But as I told our state lawmakers, our Commonwealth is strong because, folks, we are strong. We are tough. We have been through a lot, and we have the strength to get through what remains. And while I know this has been a dark year or couple years when it comes to the pandemic and those challenges, the dawn that is before us is going to be brighter and more optimistic than we have ever seen. Last year was our greatest year for our economy, for economic development in our nearly 230-year history. That's right. In the midst of all these trials and pain, we have outperformed economically every other year before us. That means we are on a roll. I'm convinced that our time is here, our future is now, and as we come out of this thing, we're going to leapfrog not just 3, but 30 states. Now, it was a special night, too, because of some families that we got to see. Families that showed heroism or resiliency throughout our trials. We had Nevin Price and his wife, Sherry, for the speech last night. I got to go to their house, which is the only one standing, for miles. That night, Nevin, a farmer in Taylor County, pulled multiple neighbors from their basements, clearing the debris just to pull them out. I remember him looking at me and saying, one group, one family, just yelled, "Please don't leave us." And he didn't. We were also joined by Kara McKnight, along with her family. It's pretty special. I met Kara at her Christmas celebration. She'd had a real tough month. She lost her brother around Thanksgiving, and then they lost their home. Their dad is a law enforcement officer in the tornadoes. But Lila and I volunteered to be her personal shoppers. I was loading her up with anything and everything. And then when her arms got too full, I started loading Lila up. And I just remember she started laughing. Like a happy, joyful laugh. And that was pretty incredible. I mean, after the month that she had, it's just a reminder that there is pure, joyful light, even in the darkest darkness. Reaching our potential is going to take cooperation, and it's going to take everybody joining on board. Next week, I'm going to introduce a budget that makes bigger investments in your future, all of our futures, than we have seen in a long time. Because if we want to grab our destiny, if we want to leapfrog those 30 states, if we want our state to be everything we've ever dreamed of for our kids, we got to work for it, and we got to have the courage to embrace it. So you'll see next week significant historic investments in education. That's what's required if we're going to continue to attract world-class companies that want a world-class workforce. It'll invest in essential workers like Kentucky State Police, nurses, and teachers. It'll make sure we remain a leader in agriculture technology in Eastern Kentucky, improve our pharmaceutical footprint in Northern Kentucky, continue our commitment to a world-class airport in Paducah, continue our work to 4-lane all of the Mountain Parkway, build the I-69 bridge, and ultimately get to the point where we can do that Brent Spence project without tolls. But I think the most important part of last night is about who we ought to be moving forward. And last month, it's the first time I've ever stood in what used to be a downtown where everything is gone, ripped apart. It was in Mayfield, in my dad's hometown of Dawson Springs. It was in Bremen. And I think everybody who has walked through those areas knows that we should all be changed people. So my hope, after everything we've been through, is that we can leave behind the anger and the hate and the division, because you know what? When someone's lost their house or lost their lives, none of the stuff that we've argued about matters all that much. And instead, together, we can stop worrying about moving right or left, but to actually move forward. And we can show those families that we truly stand with them and we care about them. And we care more about helping those families than attacking each other. With what we've experienced, we ought to be better. We ought to be able to live our faith in a way that says every other person has value, and we're not going to devolve into nasty attacks against them. We're going to work together to try to do what's right. Speaking of somebody, over the years, it's done a lot of right. Today, we have a special Team Kentucky All-Star before we open it for questions. Today, we recognize Jack Bramer, Frankfurt Bureau Chief for the Lexington Herald-Leader and a member of the Kentucky Journalism Hall of Fame. Jack retired from a storied career on December 30th. He reported for the Herald-Leader newspaper since 1978, and I can tell you that that's 43 years. Jack has covered 10 Kentucky governors, including 2 named Beshear, and many, many General Assembly sessions. And for all the events that happened in or around the Capitol, both good or bad, Jack was there. Everyone knows Jack, knows he has tough questions, but he's also fair, and he's one of the best. As he walked away from his desk and that famous iPad here at the Capitol, where he would record everything that you would say, he did just what Jack would do. He thanked all those that he worked with over the years and his colleagues at the Herald-Leader. In the Herald's recent tribute to his career, Jack said he'll miss the Capitol, even the late nights and the frantic final hours at a legislative session. He will be the only one. He said he started working here in his 20s and left in his 70s, and he wondered if perhaps a future relative of his someday will say something nice about their next of kin who once reported, pondered, wrote, laughed, and cried in the state capitol. Jack's quoted as saying, "I hope that person says of me and the place I worked," he called it a grand building filled with spectacle and news, and most importantly, interesting people. Jack, thank you for your service for more than 43 years in the Capitol, providing quality journalism. I know the Capitol will miss Jack, and so will I. So please enjoy your well-deserved retirement, going out a Team Kentucky All-Star. All right, with that, we'll open it up to non-retired journalists. We have one that's braving the weather with us here today, and then the others on the line. So, Carolina.
Governor, we are expecting quite a bit of snow in some areas of Kentucky. Is the state able to handle that amount? And also, what does the state's response look like right now?
So the question is, will the state be able to handle all the snow in each of the parts of Kentucky, and what does the response look like? Well, the answer is it depends on how big the snow is. As we discussed before, we have trucks out. We've been pre-treating roads, but if you have a huge amount of snow, it can cover it up very quickly. So I want people to know that the Transportation Cabinet is doing everything they can. They're doing a real good job, but that doesn't mean the roads are safe. In fact, right now they are slick. The best way that people can help us to have the best response is to stay off the roads unless they absolutely have to be at work or essential worker that need to be in. Some areas will probably be able to get cleared up quicker than others. And the temperature is also going to have a major impact, because if it drops, a certain amount, then even the treatments that you put on the roads can be less effective. So this is a serious weather event. Every weather event that we're having right now is serious. And I want to make sure that while I have confidence in our Transportation Cabinet and everybody out there, that people still know it's dangerous and take care. Do we have Karen Czar? Was she able to call in?
Hello, Governor.
Hey, are you doing okay? I know you were out in the weather.
I'm on the side of the interstate, but I have crumble cookies, so I'm good to go.
All right.
Governor, do you recommend at this point that schools go NTI or cancel tomorrow, or is it too early to make that call? And on COVID, are there any plans to open more testing sites? Thank you.
Well, on COVID, we have certain communities that are working to open more testing sites right now. The challenge in other communities are supplies. Right now, we've got testing booked in just about everybody that offers them. And we do believe that the manufacturing is cranking up, but the demand right now for testing is as big as we have seen it in a long, long time. And it happened so quickly. So we're going to work with each community on it. The most important thing on testing is do not go to the ER. That is not where you need to be tested. Make sure you look to sign up at a pharmacy or at a grocery store. So many other places you can go online, and you can still generally get a test, maybe not an at-home test, but you can still generally get a test within a day or so if you're really looking. About tomorrow, I'm going to let each school district look at that. I think so much of it has to do with the bus routes. There's also temperature issues tomorrow morning, but I would not be surprised if we see a significant number of cancellations. It's going to be really cold tomorrow. Roads are still likely going to be icy, and we're not entirely sure when the snow will fall and how quickly that will freeze over. But already there's ice on the roads, and this is the middle of the day. Debbie Yetter, Courier-Journal.
Hi, Governor. As you may have noticed last night, there's not a lot of masking going on at the General Assembly up at the Capitol right now. And there have been a couple of cases, at least one of a lawmaker testing positive already in the opening week. Do you have any thoughts about the safety and the potential for greater spread of the virus in the situation? And also a quick question unrelated. If the filing deadline bill, House Bill 172, gets to you today, what are you going to do about it?
Well, the first thing I'm going to do is read it. I'm going to take a close look at it, and we'll get a decision as quickly as we can. But not going to play any games with something like that. People need to have notice of what their districts are going to be. But I will want to see it, and we'll decide from there. The General Assembly, given how few members are wearing masks, isn't safe. With Omicron spreading as fast as it is, people are just putting themselves at a risk that they shouldn't. And I certainly hope that the spread doesn't occur. I want all of those people to be okay, but we've had nearly 10,000 cases the last 2 days, and 1 in 4 people that are getting tested are coming up positive. I know staff members are testing positive here around the Capitol. It's here. And listen, I don't know what people's reasons are for not wanting to do it, but I do it to protect my family and the people around me. Again, I think I'd probably be okay if I come down with Omicron, but I don't want to spread it to other people who might not be. I care more about people even that I haven't met than I worry about the uncomfortableness of a mask. It's the least I can do to live my faith and protect everybody else out there. And I mean, we've never seen this many cases. 25% almost positivity rate. I really hope that people will wear masks, and I don't want to see anybody harmed. Lawrence Smith, WDRB.
Yes, Governor, what steps are you prepared to take to supplement or help hospitals if they need it?
Well, the first 2 steps that we're likely to take when and if they need it are National Guard, and again, looking at our nursing schools and programs that were so helpful the last time. I don't think we're there quite yet, at least on the second part of that. The other things that we could potentially look at are testing, which we did the last time. But I do believe that having been through a surge before, we know the tools that we have. But with this many cases, right, if we can't lessen the growth and the spread, we're going to have a real hard time in our hospitals with the number of people that are going to need help. Melissa Patrick.
I wasn't. Hi, Governor. Well, you kind of touched on my questions today about the prisons and masking, but it seems as if A pediatrician yesterday in a press conference just begging parents to send their kids to school in masks. And I just came from the grocery and no one had a mask on. And I live in Lexington, where maybe compliance might be a little higher. Can we get on the other side of this surge if people don't practice good public health practices like masking?
Well, we're going to get on the other side of the surge one way or another. The question is how many people are hurt in the process. The number of people that we lose will be based in part on the number of cases that we have. All right, I hope that a much lower percentage of folks that get Omicron are hospitalized or pass away than Delta. But if it's 25%, yet we have 8 times more cases, we'll lose more people and more people will be in the hospital. And as prevalent as this is right now, the need to wear a mask to lessen the spread has never been greater, even if the personal threat to you might be a little bit less. People are tired. I get it. I mean, real tired of wearing a mask. Many of the people that you're seeing have done everything else we've asked and have worn a mask before and have gotten vaccinated and have gotten boosted. And I get it. I mean, 2 years is a long time to fight a pandemic, though. Our grandparents didn't walk away from World War II because of the time that it took. I need people to dig deep to know what we are looking at and to put that mask on in public. Now, we got more tools than ever before to have smaller things in private. If you want to have people over and don't want to wear masks, get a test that day, right? If everybody's vaccinated, boosted, and you test that day, then great, right? So we have the opportunity to do things, even in this major surge, that we couldn't do a year ago. We just need to be smart about it. Corinne Boyer.
Hi, Governor. What's being done to stop the current outbreaks in prisons? And then at this point, do prisons have COVID plans? Are they able to do things like separate people, give them masks, and take other steps to prevent the spread? Thanks.
So this this outbreak has come on very, very quickly, and we don't know how big it is. So the very first thing we've done to stop outbreaks is we do wastewater testing, right? And so we're not waiting on somebody getting sick and testing positive. We're testing the water as it comes out, and that ought to give us the earliest indication that we could possibly get. Now, with Omicron, that still may mean a lot of people get infected very quickly, especially within a setting like that. So different things that we have done are a pretty good vaccination rate for both prisoners, and it's getting better for correctional officers. And all of these facilities have been through this before. So they have developed their plans on, first, you got to lock down. In other words, until we know who's positive and who's negative, nobody move, because if you do, you're spreading it. And then you can sort based on the geography, the makeup of the facility, people into positive or negative, people who are symptomatic and who are not. And our wardens have been really on top of this. They have worked really hard, even being short-staffed. So I have confidence that they will do the very best they can. Masks are offered and provided, and certainly when we have anything like this, everybody has one and ought to be wearing it. And most of the time, you see pretty good adherence to that. Bria Jones.
Hey, Governor. I know you talked a little bit about staff shortages due to COVID in the prison systems. Are we seeing that in any other state governmental facilities or things like that? And what is being done to mitigate those issues that might come from those staffing shortages?
So we have concerns in different places, but this staffing shortage with corrections officers isn't just COVID. It's pay. Just like we see with social workers and just like we see in law enforcement, is that we haven't raised our salaries in far too long. We're not competitive. And for some of those jobs, when you remove the pension, there's there's no retention, right? There's no additional benefit to you staying another year if somebody else comes along and offers you more to work at maybe a less dangerous job. So our retention issues are bigger than just COVID. As far as COVID outbreaks inside of state government, we haven't had one yet that has shut down entire units. I did send a message to employees, yesterday or the day before, about how critical it is to be wearing your mask in state buildings right now, not just to protect your health, but to protect our workforce and what we do. With so many services, from ensuring bridges are safe, to drive across, to driver's license, to being there for that neglected child, we cannot afford to have an entire unit of state government sick or out or quarantined with COVID. Omicron, sadly, is going to hospitalize, and it's going to kill a certain amount of Americans and Kentuckians. But the other thing that it could do, again, if we aren't masking, is it could have a short-term impact on our economy by how quickly it spreads, and it could shut down an entire shift in a factory in just days. I worry that it's going to have a significant and severe impact on schools. I think there are already a lot of schools that are struggling with the staff or the number of students who are out. I know that we will see that those school systems that have universal masking will have fewer cancellations, will miss fewer days. I've seen that for the last year, and it's just going to increase from here. All right, everybody, that is today's update. Be safe. Don't travel if you don't have to. If you're not an essential worker, try to work from home. Be safe. The roads are going to be slick, at least today, probably tomorrow. Take care of yourselves.